Can you hear me, no Snapple? Can you hear me? Yeah, I'm live in the studio right away.
Hello, Nurse Reuben. Welcome to the show. I truly
Babe,
apologize for technical difficulties that had really thrown me off today. Welcome back. Welcome everyone who have come here today to support Nurse Reuben and to cheer him on today. This is amazing. I've been so excited about this episode, and I believe my excitement threw the computer into a chaotic mode. And I appreciate your time. Thank you, everyone who waited. And of course, Nurse Reuben himself is here. It's great to see you, brother. How are you? Oh, you're
fine, my
unmuted. Let me
director.
see.
So it's been quite a long time. I'm really honored to be
Oh, let
here
me
this
see. I
evening.
cannot hear you.
Can you hear me?
Yes, now I can hear you. Nothing else should go wrong today.
Oh no. We hope so. I'm very optimistic that everything is going normal today.
Praise the
Tonight is
Lord.
going to
Oh
be
my
perfect.
goodness.
Yeah, it's going to be
Wow.
perfect.
It will
Yeah,
be in Jesus' name.
yeah.
Oh my goodness.
Amen.
I want to
Yeah.
welcome you. Welcome you. It's been such a long time. It feels like it's
Mhm.
been 10 years.
Exactly. It's been long. It's quite a long
We
time.
get so busy doing
Yeah.
great work out there. I appreciate you waiting, Joe. And
Thank you very
all
much.
right, without further ado, let me introduce you to everyone who has shown up here today to
Mhm.
celebrate you with us, to honor you, because it
Yeah.
truly is a legacy to have you back. So,
Mhm. Yeah.
ladies and gentlemen, this podcast from bedside to global leadership, continuing the journey of Nurse Reuben Zirahgi Markus. Ladies and gentlemen, speaking with you today, my name is Dr. Nyepu Kemuho, and I have the profound pleasure to be the founder of Nurses in Charge Global. This is where we thrive. This is where we connect with other nurses. This is where we celebrate our achievements, and more of all, we empower each other. And nurses and midwives are making a world of difference here in Nurses in Charge. We have been running this organization together as a team, a global community, for 5 years by the grace of God. We are a faith-based nonprofit organization. We were established in Florida, USA, and this is a family mindset grassroots movement that we are on here, and by the grace of God, we are touching nations. We are celebrating 23 nations where we have members based, and we're growing from chapter to chapter. So today, without further ado, everyone, I welcome you to another inspiring podcast episode of the Share Your Nurse Story podcast with Nurses in Charge, the official podcast with Nurses in Charge Global, where we are connecting, celebrating, and empowering nurses and midwives globally. I am the host, as you can see. I always welcome anyone who wants to join me here. So today is a very special episode where we have the privilege of welcoming Nurse Reuben back on stage, on set here with me. This is a leader whose professional journey continues to inspire myself, okay? Healthcare professionals around the world. He touches lives beyond the scope, okay? So joining us, Nurse Reuben, since his last appearance here on our podcast, his career has launched exponentially through the eyes of research, infectious disease. This is where he tried. This is what he's always done, but he's doing even bigger things. And I cannot wait for him to blow your mind. Tell you this man has a dying desire to just touch the healthcare arena and to impact the lives and care that he provides patients within his care. So, without further ado, Nurse Reuben, please do us the pleasure of officially introducing yourself because we have lost time and I cannot wait any longer but to welcome you on stage. And I welcome everyone who has come here today to join us. You are muted, I believe. I still see your mic is off for now.
Okay,
There you
thank you very much, my director. You have really been doing a good job globally, and a lot of young nurses, of which I is a witness. We are impacting. We are really being impacted by the programs you have been conducting through the nurses in charge globally. This is really nice one, and the platform is giving us like a space in order to showcase our skills and our experience so that others will tap from the vast experience we have in our own peculiar field. So it does it in essence. So I am Nos Reuben Markus Zirahgi. I am a Nigerian from Minchka local government, Adamawa State. So I am a PhD candidate. So my background is nursing. So I'm a registered nurse, registered midwife, and registered public health nurse. So I have my diploma, national diploma in nutrition and dietetics back then in 2012, and I have my professional diploma in tropical nursing from London School of Hygiene and Tropical Medicine. So I have my postgraduate diploma in infection prevention and control from UK College of Pathologists and British Society of Antimicrobial Chemotherapy with MSF Academy. And I have my master's in public health, and I am currently running to do my own proposal defense on that's in masters in nursing and health administration, and concurrently running my PhD where I am concluding with the PhD, looking up to graduating in the year 2027, either early or mid of the next year. So, and I have vast experience in different fields. I have over that's 12 solid years of working with humanitarian organization. I started working with organization back then in 2016 with
go.
MSF France. I started as nutrition assistant because I possess nutrition, and I used to be practicing as nutrition dietitian as I've done. And after 2 years, I was transformed to work as nurse assistant. So after completing my degree, I have to move on to start practicing as a nurse. So from there, I've not spent much time practicing as a nurse with the same MSF, although it's MSF Belgium. So I have to move toward MSF, that's Intersource, to work in deep field as nurse clinician, and later on became a stabilization center nurse with the same organization. So I also work with Medicine du Monde, popularly known as Doctors of the World. During the cholera emergency outbreak, I served as the interim nursing team supervisor, where I led the fight against cholera by setting a cholera treatment unit and cholera treatment center, and coordinate the healthcare team for timely intervention and healthcare aware that's health education and health awareness regarding the prevention tips of this cholera, and as well as vaccine and house to house campaign in order to tackle this outbreak. I also work as nurse case manager with Chemonix International, where we intervene in people with or HIV. We do contact tracing, having a discussion with them, and ensuring they check their medication, and also check their viral load to ensure that it's at a minimal level that will not cause harm to them or even make them expose them to some comorbidities or any other disease. So in and aside from that, I work with Rescue Health Initiative as their information publicity and advocacy manager. And currently, I'm running my own small foundation where I see the needs to support the orphans and children and women in order to gain. In order to ensure equity and equality in some of these social and health care related services, because they are most there is gap, there is healthcare gaps, and most of the people that suffer this gap are these categories of people. So currently, I'm serving as nurse mentor with the mentorship in Sierra Leone, though I'm now on my personal time leave. That's a PTO, personal time off. So for just short period of time, I will still be going back to Sierra Leone to continue impacting the local nurses, to train them, build their capacity so that we sustain the program of safer surgery through mentorship. So this is Nurse Ruben in just brief. So thank
Yeah.
you very much for the opportunity to introduce myself. Thank you.
Wow, Nurse Ruben, you are. Listen, I am scouting for a mentor, and I check you off to to truly you are one person with this big heart. You really want to impact the world you live in today, leaving a legacy, but you're leading the legacy now in this lifetime. Most of us wait till, our legacy speaks for us afterwards. Yours is speaking for you now. And kudos to you, kudos
Thank
to
you.
your family, because
Thank you.
everything you listed that you have achieved,
Mhm.
all of your degrees, your certificates, and now you're in PhD, you're taking undertaking your PhD
Yeah,
program. It takes a village to raise such a nurse. It takes a
sure.
village, and that village really comes from your inner circle. That
Yeah.
wife you just married, congratulations, right?
Thank you very much. Thank you.
So that support that you're getting from her and your
Mm.
parents and your friends, your close knit families. I hear everything you've achieved, but then I have to think outside of the box, outside of the circumference of what you've achieved and everything you're giving back to the world. And I have to
Mhm.
stop for a moment and say thank you to your
Mhm.
wife, to your parents, to your siblings, to your friends, everyone that have encouraged you, whether it's just saying a word of encouragement versus being there to support you tangibly.
Thank you.
It's not
I'm really
easy.
honored.
Seriously,
Thank you.
on a serious note, it's not easy to rise above, from a grassroots, from the humble beginnings up. And
Exactly.
that force that's driving you, that spiritual
Mhm.
force, God Almighty, I say thank you, Lord, because
Amen.
it's
Amen.
not easy. For those who are listening, I want us to just take a moment and just thank God and thank all the supporters that have embraced your achievement and says, Ruben, we're behind you, full
Mhm.
force. We're with you all the way. It's not a solitary movement in life. You have to have the community support. And I want to believe that you have that.
Thank you
Thank
very
you.
much. It's my honor.
Thank you.
My pleasure.
Wow. Wow. You always amaze me when I think about your milestones, and you never stop. You just want to continue sprouting, and you're soaring right now. So congratulations to what you're
Thank
doing
you
out
very
here.
much. Thank you very much. Thank you very
I
much.
see some people have already joined to support you.
Mm.
Um, I will keep popping their names out there so you see who has come along to cheer you up. Okay. That's Michael, I believe.
Wow.
Michael Oyibodi.
Mhm.
Yeah, he's admiring you. And then I see Cassie Notes.
Yeah.
Good evening, all. Welcome, everyone. Welcome, welcome. This is what nurses do when we cheer each other up. This is where we come to give our stories for the world to see that we're not just serving patients, we are impacting our communities and impacting the globe as well. But sometimes our stories are not told. Nurses in charge does not wait put you in a waiting list for you to meet certain criteria. So today, Nurse Ruben is here today. I had just few questions, and I know he will tell us all the gist of it. So, Nurse Ruben, I'm glad that
Okay.
you're giving us your background there. And for those of you who have never heard Nurse Ruben, he was one of our earliest podcast episodes featured back in 2025. So if you missed that episode, go back into Nurses in Charge YouTube channel and it's all there for you. Today, I want to talk a little bit about infection control, the where you're specializing, right? So
Yeah.
as
Yeah.
an infection control prevention and control specialist, health, you are a public health researcher and one health advocacy that you are involved with. What do you believe is one of the biggest challenge, right? The
Yeah.
challenge that you've encountered, and let's start with the challenges, then we'll talk about opportunities
Okay.
that you believe nurses are facing right now, and you yourself have encountered some of the challenges.
Okay, so thank you very much once again, my director, for this wonderful opportunity to share a lot of things with the young nurses or the nursing world
Mhm.
through your platform. So, to be candid, healthcare is evolving rapidly, and I don't think anyone can deny this fact. And nurses are no longer expected to only be at the bedside just as caregivers, because just of recent there was a statement made by International Council of Nurses regarding the shortage of nurses in the public domain, that's public health aspect. So in other sector, most of the nurses are what gearing are channeling toward their side. This is a valid statement. Abstractly I've seen, and this is what is happening, and there are more. Yes, of course they are needed in the bedside, but they are
Mhm.
still more needed in the public domain because of the emerging issues we are having. So we are becoming clinicians, researchers, educators, innovators, policy makers, and global health experts in our various fields in order to make an impact, and order to remain relevant. And if to remain relevant, every nurse must understand the emerging trend that are reshaping what the healthcare system. But despite all these things, we are facing a challenge, different kind of challenge. And one of the greatest challenge facing the global health today, most especially in my own field, I'm so much concerned about antimicrobial resistance and the equitable distribution of knowledge in terms of what the emerging technologies such as artificial intelligence, which help us in doing one, that's in performing our duties as infection preventionists or specialists. So these are emerging technologies that will assist you, and we are gradually entering an era where there are common infections that may be difficult or even impossible to treat. Talking about the antimicrobial resistance now, if we
Mhm.
fail to preserve the effectiveness of antibiotic, which is very common here in my side, most especially in Africa,
Mhm.
so nurses have a critical role in antimicrobial stewardship through infection prevention, patient education, early detection of infection, specimen collection, and advocating for the rational use of antibiotics.
Mhm.
So, preventing infection is one of the most effective strategies for reducing this antimicrobial resistance. But the cycle, that's within Africa, the involvement of these nurses is not as much as we want, or as
Mhm.
much as expected, not as we want. I don't want to be selfish because we are serving the world, the entire world, and we are doing that through the largest workforce, which is the nurses. They are the largest workforce and they are skilled healthcare workers, well trained in order to perform all this role. But they need support and training from the government agencies, from the non-governmental organization. I've seen some training coming from different angles, which is yes appreciated, but we need more to involve the nurses in doing that. So
Yeah.
limited number of these infection preventionists, it's really a biggest challenge to us. And they imagine that's the increase in this misuse of antibiotic, which is leading to what antimicrobial resistance is another challenge, and
Mm.
as well ineffective or inequitable distribution or even like training or the knowledge of these
Mhm.
artificial intelligence which are meant to support us, most especially in the low and middle income countries. So another major challenge is the increasing frequency of emerging and reimagined infectious disease. Just of recent,
Mhm.
before I left Nigeria, um, I was working with MSF and we had like multiple outbreak of infectious disease.
Mm.
So yes, we had an outbreak of diphtheria, we had an outbreak of measles, we have an outbreak of meningitis. Imagine these
Wow.
are emerging diseases. So
Mhm.
they are what? They are coming at the same time. So it takes a skillful and also like enough workforce that have skills in order to help in dealing or what preventing and controlling this kind of infection. So let's take for instance the COVID-19 pandemic reminded the world that outbreaks can what overwhelm even the strongest health system. So it has already proven that. Since
Mm.
then, we have continued to witness diseases such as mpox, currently Ebola outbreak in DRC, Lassa fever outbreak in Nigeria, and other zoonotic what infections. These are what highly infectious disease that can be transmitted easily. So, and the
Mhm.
manpower to tackle this and the training is limited. This reality demands the nurses to remain prepared through what continuous education, surveillance,
Mhm.
outbreak responses, and emergency preparedness. So I always said most of the people that are at risk of what all these highly infectious diseases are the healthcare workers, because without you being having the knowledge to identify this early, you will be the victim at the end, because the person will approach you and you will not even suspect that this is the case because of limited knowledge in terms of this particular disease, and it will become something else. So we need to give our attention in this aspect to ensure that we what deal with it. So equally important is the one health approach, which recognizes the human health is closely connected to the what animal health and the environmental health.
Mm.
I decided to I opted toward one health as infection prevention is because of the interconnectedness of these three triads. If you if you have skills of one part of it, it might be difficult for you to handle all these things. So you need to what incorporate the other aspects of prevention from the other triads or components in order to fight this disease. And these are courses that are not common here. They are just new, they are just introduced
Mhm.
in order to what build people, and I can't see them in many universities. So many infectious diseases originate at the interface between human, animal, and environment. So nurses should therefore appreciate the word infection prevention extent beyond hospital. So not only in the hospital, which is also a challenge now because we don't have much in the
Yeah.
hospital. Environmental sanitation, food safety, water quality, waste management, climate change, and animal health all influence what human health outcome. So future healthcare leaders must think beyond hospital wall, and
Mhm.
the government must also think beyond. We need more researchers to research deep and what make sure that the what the outcome, the answer of those researches are what utilized by the what by the
Mm.
policymakers. So these are the things. So another one I've been mentioning what digital transformation is also present. It's a tremendous opportunity. So I made mention of artificial intelligence. There are digital health record, telemedicine, telenursing, predictive analytics, and data science. They are changing the healthcare delivery, but we don't have few hospitals that are have started implementing all these things are also facing challenges. We have limited resources in order to what to incorporate this thing. So rather than fearing the what the technology, nurses should embrace it while maintaining what the human compassion, because we can never what do away with human compassion that defines our profession. So, and one good thing is that one of the challenge is the feelings. I don't know whether it is the feelings that is making nurses not to embrace AI, but the feelings that what AI will replace nurses, which I don't think it will. But
Yeah.
nurses who effectively use what AI may transform healthcare outcome. That's and outperform those who do not. You have to complement work with each other. So there is lack of knowledge of even understanding how to use the AI or how to utilize the AI, despite lack of the what equitable distribution or knowledge of the AI globally. So there is what lack of understanding of how it will work. We all thought it will what take away our job, but I don't think it will do that. You have to. But one thing I tell nurses these days is that if you fail to use AI, you
Yeah.
are in trouble. But if you allow AI to take over you, you are in trouble.
Yeah.
So your level of intelligence will be measured through what through your ability to work hand in hand with the AI, complementing the work because it was meant for a purpose, not to take over your work and not for you to also work without it. Because if you can't work without it, you are not moving with what the trend, evolving evolving world, which
Mm-hmm.
is trying to make things easy. So another area requiring attention is like I have mentioned it, I will still mention it,
Mm-hmm.
strengthening this infection prevention and control system.
Mm-hmm.
The system is really weak, most especially in Africa. Yes,
Yeah.
it's weak.
Yeah.
You hardly heard about if I used to be on LinkedIn and I used to follow up with a lot of infection preventionists. Only few are from Africa. I don't know whether others are hidden behind, but I don't think we have much as we have in other or developed world. So
Mm-hmm.
it needs an attention because it helps. Infection prevention should never be viewed as what responsibility of the IPC team alone.
Yeah.
So it's a collective responsibility. Everyone is IPC ambassador. When you fail to what take your responsibility as IPC ambassador, the system will fail. So every healthcare workers from leadership to frontline staff should share responsibility for patient safety. Strong IPC program improve patient outcomes and reduces healthcare costs, combat antimicrobial resistance, and build resilient what healthcare system, and also reduce what healthcare associated infection, which has become a menace. So one of the things, again, lastly, I don't want to take much of our time explaining all these things. There is what our lack of um, enough researchers. Can
Mm-hmm.
I can understand the challenges here, lack of funding, it's really affecting. We have a lot of research gap. We have a lot of
Mm-hmm.
things to research. We have a lot of things to conduct research on. But the
Mm-hmm.
fund to do that is a challenge because most of our system do not provide what like a research fund. Most of the system, it's unlike the
Okay.
what advanced world. So research is another tremendous opportunity that we are missing over here, and it has become a challenge. So healthcare, my advice is that healthcare should what increasingly be driven by what evidence based rather than tradition, and this must be done through what the support they will get from the government, from
Mm-hmm.
non-governmental organization, and from what philanthropists. So nurses are uniquely positioned to identify clinical problems, which can be what subject of research, conduct research, implement quality improvement project, and translate evidence into practice. Every nurse should develop research literacy because the future of nursing depends on what generating evidence that improves patient care. Without
Mm-hmm.
research, I don't think all that we are doing is going to be visible. Thank you very much.
Nurse Ruben, thank you again, thank you again, because you mentioned several crucial points when it comes to the challenges facing nurses who are nurses being a majority of the healthcare professional uh, um, that that we have today. I believe by last year, the World Health Organization did a study where nurses compose of over 60% of the healthcare sector, right? So if we
Yeah,
have
yeah,
a lower participation among nurses, in
Yeah.
infection control, that means more of our patients are being infected or cross contaminated by the same hands that are meant to bless them with healing, right? So
Yeah.
lack of knowledge, the Bible says, with lack of
Perish.
knowledge, my people perish,
Yeah.
right? So
Yes.
I see a um from what you explain, it
Mm-hmm.
almost want to it makes me wonder, is it the lack of training available versus the zeal to be a part of the process, the change, the the zeal to be a change agent?
Yeah, I think what the problem here is not that there is no zeal or it's
Okay.
lack of training, it's lack of a strong system. And one of the problem is that
Mm,
leadership remains one of the greatest opportunities before any profession. And nurses constitute, as you have said, the largest proportion of the world
mm,
global healthcare folks. Yet they remain underrepresented in policy and decision making. Imagine if we have
absolutely.
nurses in decision making, at least they will understand the value of this field and put it in place. And as well, what recruit enough nurses to do that, because there are a lot of people. I just launched a program, 2 month program for young people that are willing to become IPs, and they in truth there are very many. They
Hmm.
wanted to do it, but they don't have money. I have to reduce it to the minimal base that they can afford. And despite that, some couldn't afford. So the future requires nurses who can influence healthcare policy, manage healthcare system, advocate for vulnerable population, and contribute to the national and global health agendas, of which infection prevention and control is one of the
Hmm.
biggest part of these national world health agendas. So this
Yeah.
is what I noticed.
Wow. Wow.
Yeah,
So you truly have noticed a lot of gaps that need to be filled, especially when
yeah,
it comes to the era of research that we truly should be spearheading the research arena, because
yeah,
we are the hot contact with our patients. Doctors come and write prescriptions, right? They give us
yeah,
the plan of care,
yeah,
and nurse practitioners as well. I don't know about
yeah,
Nigeria,
yeah,
in parts of Africa where I've noticed nurse practitioner is not really popular, but the physician assistants are more popular than nurse practitioner. But in other words, we do have providers that are writing orders, giving it into the hands of nurses, but then at the end of that, the patient is receiving a care that needs to be provided by a competent, well prepared nursing professional and or a midwife that is
exactly.
rendering the care, right? So in that sense, an infection being one of those areas of impact that can ravish lives in dozens, we need to have the information up to date into our
Exactly.
hands and equipped to apply it. So
Exactly.
if nurses are, if they have the zeal to be a member of the team, then my next question is, why are institutions continuously, and this is not only in Africa, this is happening even in the developed countries, in the industrialized worlds, where nurses are highly educated, but they are not brought in onto the decision making platform for their voices to be heard, because again, we are the one providing the direct care and or making decisions that impact the patients at the bedside and or within our communities. So where do you find that these challenges, who is it coming from directly? If it's not on the nurses end, is it the institution or government?
Yeah, let me use Nigerian in this context,
Mm-hmm.
because I understand it much better than any other place. So in terms of Nigeria, I think all the aspect has issues. The challenges comes from all the different aspects.
Okay.
I will start with the nurses. One of the challenges we are facing from the nursing aspect is lack of will and
Mm-hmm.
commitment from most of them in order to go into what governance or even to go into politics.
Okay.
which is one of the most important thing in life. Without
Mm-hmm.
you in politics, no someone will make decision on your behalf, which is not supposed to be. But we need to what participate in politics of any form, be it in the school, be it in our professional body, be it in the secular governance or secular politics. It's very important and it's key. Sometimes we are largest. I am imagining if we can positively utilize our numbers to cause change. Because when I look at the word government, some said what advocacy or the use of what social media to advocate is one of the third most strongest weapon in order to make create change. If that is the case, we have the power, but underutilizing that power is affecting us.
I
So
see.
we need to what, learn how to utilize our power, not to cause chaos, but to
Mm-hmm.
what influence what decision and what call the attention of the government and the leaders to listen to us, because anything, any decision we are trying to make or input we are trying to give is going to positively impact the entire nation. Because when
Yeah,
you take care of a nurse, you are taking care of entire nation. So I
absolutely.
was telling someone you won't even believe or understand the importance of a nurse until when you fall sick and you are on the what
Yeah,
sick bed, you will know how
yeah,
important a nurse is, no matter
yeah,
who you are.
yeah,
So
yeah,
this thing should what reflect in our mind that these people are really important, and we need to what develop their capacity. So
yeah.
the underutilization of our power, lack of advocacy, lack of willingness to participate in
Mm,
politics, and even decision making or leadership is one of the things that is affecting us. And the other one is lack of craving for more education, because most of them it becomes like a challenge for someone to go and what and study further.
yeah,
And one thing I believe in, no matter how skillful you are, you need to what? You need to upgrade to what? Match that qualification with your skills. The
yeah,
same thing. If you have what? Qualification, you need to upgrade your skills. You need to
yeah.
go and get again experience so that when
Mm-hmm.
you speak, people will be seeing the certification, the qualification in you. And when you what? Practice, people will what? See the qualification. And when people
Yeah,
see your qualification and when you practice, they will be seeing the skills in that qualification. So
absolutely.
not one way. So the other,
Absolutely.
the second one is the institution. The institution
Mhm.
is mostly monopolized. I always tell people where there is no competition, progress will be very limited.
Mm.
So the leadership of Nigerian hospital is mostly occupied by physicians, and I am not comfortable with that. Physicians,
Mm.
yes, they are good, they have studied. I don't know the level of their study in terms of leadership, but I so much believe I'm very optimistic with the what leadership training of nurses right from the undergraduate level. They are well equipped to serve as leaders. So I don't want to be certain about their own, but there is should not be a one-man position. This is a leadership position, and anyone can be a leader. And
Mm-hmm.
I always tell people that we should never underestimate the power of one committed nurse, because one committed nurse in leadership position can transform the entire institution or healthcare industry more
Absolutely.
and far better than anyone can do. Likewise, other healthcare profession. So lack of this competition has make us to be more like backward, and we are not even understanding that this is what 21st century where anyone can lead the what healthcare industry as far as you are what you have the capacity and the qualification and the skills as a leader to do that. It's not like a one man or one profession position.
Mm-hmm.
So this leadership, the system structure of the institution is really affecting the it's one of the biggest challenge affecting the nurses,
Mm.
which need transformation, even though I don't see it any moment soon. And
Yeah.
this
Oh,
causes a lot of
that's hard.
disharmony. Yeah, it causes a lot of disharmony between the nurses, other healthcare workers, and the physician. And we are meant to serve the patient, not to serve or feel inferior or superior to
No.
anyone. Because everybody is unique in his own aspect or profession. We only come as a team to serve someone, to serve a king. That's the patient. And we need to do everything at the best interest of the what? Of the patient, not our own selfish interest.
Mm-hmm.
So I think this is one of the reasons why they are not like they are not. This is one of the biggest challenge. And when we come to the government aspect,
Mhm.
so like I've said, from the leader, from the institution, even in meeting, you will see one nurse representative. All the other people who might be physician and others people. You see, one
Mhm.
person, even if you are right by vote, they can what? They can beat you down. No
Yes.
matter how evidence you have, no matter what evidence, unless in a place where they will look at evidence rather than looking at what profession, which
Mhm.
is what we need and what we crave for. And I'm praying for when this will be, so that we'll have a very transformed healthcare industry and have people utilizing or exercising their full authority to practice and also work as a team to provide the better and that's safe healthcare to the patient. So from the government aspect, there is lack of what supervision, monitoring, and support. The welfare of the nurses is really far, far, far behind, and it's not even tallying with the word economy. One tragedy in the governance was that when there's what a drenchment in economy,
Mhm.
the nurse's salary will still be there. It's really demotivating if your salary cannot cover your basic needs. It's really demotivating.
Yes.
And there is what shortage of manpower. A lot of nurses are what migrating for greener pasture. I am expecting the government to look at why they are migrating so that they
Yeah.
will tackle that problem, because there must be a problem for a nurse to migrate for a greener
Yeah.
pasture.
Yeah.
Look at it, benchmark and support that nurse to stay back. Home is home, home is sweet. Give the nurses what they want or what they deserve. Let me not be using what they want so that it will not sound selfish. Give them what they deserve. Provide good housing for them.
Yeah.
Employ more nurses. Provide good what equipment.
Mhm.
Ensure supervision and monitoring so that all this equipment will be maintained. I think if the government will do that, it will help in what? In bringing out the best in nurses and also impact the patient
Yeah.
and ensure a greater patient satisfaction. So this
Wow.
is what I can say regarding the three
Wow.
ties and how they
Wow.
are connected, becoming a
So,
challenge. Thank you.
so you hit the mark on, and I took you in a circle, and you came back four square. So,
Yeah.
the reason I did that is because if we have, for an example, infection control training opportunities, right? And then
Yeah.
with that said, we have nurses who would love to learn new modalities, new techniques, new knowledge coming on board on how they can take care of a patient with typhoid or malaria or cholera. What is the incentive in going to get this education if I'm already not being, my wages have not budged, or we've not been paid for months, and I have to go out there and work in the market and do other businesses to provide for my family. So there is no encouragement internally within the healthcare sector that hire nurses. There are no incentive or encouragement from the the legal sector, government, you name it, right? So I come from this point because I did a tour in Liberia, and I
Yeah.
realized that nurses are, they are either
Yeah.
not paid or very much underpaid. So there's this level of scarcity that's happening within the nursing and midwifery community. So we want to train, and it is amazing that you have come this far with so many certifications, so many different levels of degree in your education and training, even though you're based in Africa. But it has to take that internal desire to make it anyway, anyhow, plus the support you have, because it's not easy to get a training and or get the next degree. It's very expensive. So we need more nurses to be trained because emerging diseases are nonstop, right? We have new mutation of the same diseases that we've dealt with throughout the ages, but we need an incentive. We need to be paid. We need to be, our wages need to be up to par, where we can take care of our necessary needs and get a higher education and get more training that are necessary to provide the best outcome of care for our patients, right? So I love the fact that you touched on continuing education. You cannot leave graduate schools and or even undergraduate and stop. If you do a full stop, your knowledge declines over time, right? So that was one of my questions to you. What would you say about continuing education? But you hit that as well, right? You encouraging nurses and midwives to continue learning because truly you have a greater advantage to do something beyond your current location. If there's an opportunity that comes up, they'll pick this nurse who have been polishing his or her skills. They are more competent in that area. They will pick that nurse. So the opportunities may not be now, but it may come later on. So a lot of us need to learn that what we invest in today in our profession, into our education, it will pay off later on, right?
Exactly.
And I believe you can attest to that so far,
Exactly.
that you have not stayed stagnant. You have continued to look elsewhere. Wait a minute, what are they doing over there? I want to go learn that. What
Yeah.
opportunities are there? Let
Yeah.
me go see what's new for me. So um I want to see if anyone else had any comment to what you said already.
Mhm.
Let me see here. I'll go back here. If there are any questions, so we can entertain those questions. Um, I'll just click on every comment so that we can make sure we don't miss anybody.
Yeah.
And good afternoon. Um, wow, your portfolio is very rich, sir. Hard work really pays off. You are well appreciated, sir. And that is from Michael. And
Thank you.
then we have Nayor. This is my mother. She's in Liberia and she is saying, good
Thank
evening, Nurse Ruben and Nurse Niepu.
you. Yeah.
Congratulations, NIC. Nurse Ruben, very excited for you. I am
Yeah.
watching you from Monrovia, Liberia.
Wow.
Thank you, Mom.
I'm really grateful. She's always here for us. Maybe I will one
Always.
day get into Liberia from Sierra Leone to say hi.
Absolutely. And you're not too far from it's just a
Yeah.
canoe ride, maybe. You're not
Exactly.
too
Exactly.
far. So
Yeah.
Nia, thank you for coming. And thank you for your words of encouragement. Moving forward, I also see here Cassie notes says Ruben has always been an inspiration. Thanks so much, um, ma'am, for all you do. You inspire us too. Thank you so much. This is a teamwork. We iron sharpness iron. This is what nurses in charge believes. Um,
Exactly. Exactly.
Congratulations, she says. And then there's another one here from Moses Johnson. He says, I'm really glad that I heard your story in nursing. It's a privilege. I'm also aspiring to grow higher in nursing. Awesome. Your story taught me that someday that somebody can come out of somebody can come out of nobody, meaning someone can be recognized globally, even if you are not son to the most famous family and politicians. Absolutely. So Moses, this is nurses in charge. We all have humble beginnings, and we're polishing each other. We're propelling our professional milestone here together. So feel free to join the global family here. We're always encouraging each other to do better, to climb the heights and not be stagnant. Um, Here we are, and Cassie said very true. She agreed with some comments you were saying. Um, she's cheering us up. And then NC also says, sorry, Hensi, if I'm um, uh, chewing up your name here. So he says, I am nurse. Oh, yeah, Nafaria. RN joining, watching from Izar Bachi State, Nigeria. So he's glad that, okay. Thank you so much for joining. Also, Cassie said, thanks, Ruben, for sharing these points. Cassie, you should join this podcast one day so you and I can talk. It sounds like you have some insight. This issue of leadership isn't just from the institution alone. Government, as well as the nursing governing body, has a lot to do when it comes to the welfare and motivation of nurses. So there's nursing governance, the lack of governance that's happening because we truly need to anchor ourselves into governance to propel up. And then Grace Lloyd was here last week. She was featured here on the podcast. Grace Lloyd says, good evening, everyone. I'm Mrs. Grace Lloyd Brown. I'm watching from Liberia, Nimba County, Ganta City. Thank you, Grace. Moving on, Cassie also says they don't care about fixing the problem. Instead, they focus on keeping them back and seizing their rights. It's sad, I must say. Thank you for your insight on this because this is a global issue. Seriously, it is a global issue. There's a large number of nurses trained. The problem is modalities put in place to accommodate the trained nurses. Clinics are limited, locations and resources are limited. So you have the training, but you don't have the modalities to apply the training. So is incomplete there. Recruitment is the problem already. And then Nurse Ruben, these are facts, and every nurse have a role to play in order to affect the change we are hoping to get. We have to take personal responsibility in some of these issues because
Exactly.
sometimes we ourselves,
Yeah. Yeah.
yeah, I'll let you speak on that while I look over some of the.
Mhm. Yeah.
Okay, Michael came back to say, how does AI impact nursing professionals and improve patient-centered care? That was the point you mentioned earlier regarding some of the challenges. So I will speak on the fact how AI impact nursing, the nursing profession. Um, Michael, I want to take you back to before we had electronic health records. When it
Yeah.
came on, a lot of nurses, especially older nurses and doctors who were close to retirement, they left the field because they weren't willing to allow technology to change the way they provided care and or how they documented. They wanted to still be on manual documentation. Same situation here, different strategy, different modality, but the same technology evolves, will continue to evolve. We have to go along with the evolution. So AI is here to say, okay, instead of going to encyclopedias that we used to have back in the ancient days, now I have all of the information you need in
Yeah.
one setting, and all different apps have different strategies. So learning how you can use all of the information that have been poured into these systems and and save time. Instead of sitting and typing for hours, the AI, you and the AI can communicate. Instead of sitting and waiting for the definition and or the mode of action for certain drugs, AI has it for you. If you need AI to speak it out loud, it can do it for you. And there are different ways AI works in the clinical settings. So we need to now go and learn how those applications can make our patient care more in a speedy manner, and not spending all our time reading about it. We can actually read with the system. So if anything, that's one of that. Also, our computer generated IV pumps, right? Or we have computer generated medication dispensers. All of those are AI innovated. So if you don't learn how to control the system to work with it, then you will be behind because other people have already gone a few steps ahead of you. So that, if anything, to give you a clinical example of how AI is changing and or impacting our lives, is time. It saves you time majorly. It saves you time so that you're not spending too much of your patient care hours into trying to strategize things from the way we used to do them. Nurse Ruben, do you have anything to add to that? Any comments
Yeah,
on how
yeah. I
AI?
think AI it's very important in all aspect of nursing care because you can use AI. We have a lot of data that nursing has a lot of data based on our intervention and a lot of things. So it will help in what like preventing the repetition. Because sometimes there's repetition of some data, so it will prevent that. And AI will help you in what nursing care. You can be tracking your nursing care because when you said an AI powered system can help you in delivering some nursing care while you track what the nursing care that is being delivered by this AI. AI it helps you in research because it can give you an outline of research when you want to check some of the things. It will help you in doing that. It will give you ideas and give you a structure of how to go about it. So you see, it has a lot of things from administrative, from clinical system, from that's administrative burden because it can what dictate the pattern of your staffing system and a lot of things that has to do with even budgeting, even payment of salaries, and a lot of things. AI can what reduce the burden of this as far as it is what it is fixed or if it is programmed in this
Mhm.
aspect of administration.
Yeah,
So it has cut across all the aspect of nursing, and it will help in reducing a lot of things, a lot of burdens, and even documentation and providing of this care. So it has
yeah,
impact in all that we are going to do as nurses.
absolutely.
Yeah,
Absolutely. And as you were speaking, Nurse Ruben, we'll close this question up with the fact that you can even use AI to educate your patient in their own language.
exactly,
Instead
exactly.
of trying to speak English to someone who, I'm from Liberia and my dialect is Pele. Instead of trying to relate it in English and broken English for the patient to understand, you can put that education, and AI will bring it into your own language and make it sound like you taught them all this while, but the patient will respect the fact that they can hear it in their own language. That is one basic tool that using it at the bedside and or inpatient care settings, no matter where you find yourself, it really helps to bridge the gap of language barriers for patients. Even patients who are they have visual impairment or they have auditory impairment, no matter what the language barrier are, AI also is in that area, really helping us to bridge that gap and reach our patients at their points of need. So that's one area. But you have to have an open-minded spirit to
Exactly.
continue advancing yourself there. All right, Nurse Ruby, I believe we are at the tail end of our talk.
Yeah.
And let me see. Mm, Okay. I believe we touched all these points here. So, with that said, is there something new that's happening now in your life that you want to bring up? Any policies that have been approved lately that you want to brag about and just give kudos to your supporters who have been there with you? to spearhead,
Yep.
especially
Yeah.
the nurse
Yeah.
title. The nurse title.
Oh, very important, very important. I think since my last appearance on the Nurses in Charge podcast,
Mhm.
so I have achieved some, there are some most significant milestone I achieved in my professional and academic journey. And one of it is the initiation of this nurse title.
Yeah.
So, I always tell people that we need to be proud of being nurses. We need to be proud of being addressed as nurses and even address ourselves as nurses because that's our title. So all other things are mostly ranks or licensure credentials or they are what academic credentials.
Mhm.
Addressing with your ranks, it doesn't make it more professional, or your what your license credentials
Yeah.
or licensure credentials or academic credentials. But if you meet the requirement of becoming a nurse, you need to be addressed as a
Yeah.
nurse. And
Yeah.
if you want to use the name so that people will know that yes, from far this is a nurse, you need nurse
Yeah.
Reuben or nurse Nepo. So, but this
Mhm.
nurse, looking at it, is too long. I have almost three names. So if I should put this nurse, which is what 5 words, it's too
Yeah.
long. So we need
Yeah.
what an abbreviation, which is the short form of the word of the title nurse. That and
Yeah.
nurse is a monosyllabic word. Nurse, unlike what pharmacy. Pharmacy is
Yeah.
what trisyllabic. That's three syllables. Nurse is one
Mhm.
syllable, and one syllable can only be abbreviated with only two letters. It's either the
Absolutely.
first and the last letter or the first and the middle letter. And this is why we got the word title NR for what
Yeah.
nurse. And NR is not registered nurse, but the title what abbreviation for nurse. Registered
Yeah.
nurse is RN, and it what it is licensure credential, and it goes post nominal. That's after
Yeah.
your name. While the nurse comes what pre-nominal. That's before your name.
Yeah.
You put nurse Ruben and put all your what credentials afterward, which is very important. So there's a lot. It is getting more strength because I see a lot of people from different countries using it now.
Yeah.
Whenever we had a chat or discussion with people from different countries, I used to tell them,
Mhm.
let's wear it with prestige. Let's tell people who you are. We are
Yeah.
competent and we are leading in every aspect. So using it will tell people that wow, nurses deserve to be in this position, and wherever we are, if anything we make, the glory will go to nursing, and it will always be appreciated and always be remembered in terms of anything, which is
Yes.
good. And I think I would like to also express my sincere appreciation to nurses in charge for inviting me back on this podcast because
Of
and
course, this
also
is home
advocating,
for you.
yeah, and also advocating for this nurse title. So it is always my privilege to share my journey, and I hope my experience continue to inspire nurses across the world. So since my last appearance, I think my professional journey has been both transformative and what rewarding. Because one of the biggest milestone was joining the mentorship. I joined mentorship January 8th
You.
as infection preventionist. After
Yeah.
6 weeks, I was what transformed to be the senior infection preventionist in Sierra Leone on the ship.
Congrats.
So where
Congrats.
I led the infection prevention activities of over 500 crews and patients. So where
Wow.
I had opportunity to contribute to strengthening of what patient safety in reducing what a resource limited surgical setting, though in a world class world hospital on the ship. So one of the achievements I'm particularly proud was supporting the reduction of our overall surgical site infection rate from
Wow.
approximately 3.5% to less than 1% across nearly 2,000 surgical procedures, which was
Ooh,
first of its kind and has what draw attention toward my
yes.
intervention through the team. So even
Mm-hmm.
more remarkable was achieving what zero surgical site infection in orthopedic surgery for pediatric,
Wow.
demonstrating a strong infection prevention and control system, multidisciplinary work, and continuous quality improvement.
Mm-hmm.
Excellent outcomes are possible regardless of what resources constraint. So beyond surveillance and clinical infection prevention, I also focus on education and advocacy. So during the World Hand Hygiene Day celebration, I coordinated what became the Hostel Maiden Awareness campaign, including engaging in choreography that actively demonstrated the importance of hand hygiene to over 300 crew. They are all, I mean, some said the outcome was of that choreography. Some said they have never knew that there is a steps for hand hygiene. So it has created a new avenue for
Really?
Yes, yes, and most of these people are, some of them are from US, some are from Netherlands, a lot of them,
Oh
majority of
my
them,
God.
other from other part of country, part of the countries. This innovative approach helped reinforce what behavior change
Yeah.
among the crew, the volunteers, and the patient, because we followed word to word to advocate for the patient, to create
Yeah.
awareness. I also delivered presentation on the impact of microbes and surgery, where I
Yeah.
took sample with the support of lab and word. We cultured those sample. We cultured the what, the bangles, the rings, the
Mhm.
nails, and part of the
Oh,
hands. And the staff
wow.
were really, that changed their behaviors instantly. So it attracted one of the comment on the LinkedIn, where one
Yeah.
of our staff, I think she's from Netherlands, if I could, no,
Yeah.
Australia. She said right from when she met me, her what nails always are short because I
Yeah.
disturb them. They always see me as a police, but I said no, I'm your friend all the time. So
Yes.
one lady from American from US, she told me, Ruben, whenever I woke up, I'm on duty.
Yeah.
She always Ruben. She has to remove all her bangles and other things, which is very important. It's highlight what how microorganisms influence
It's
surgical
an
outcome.
eye-opening experience. What?
Exactly. So
Wow.
another milestone has been transitioning into more education focused role now as nurse mentor with mentorship.
Awesome.
Now I'm no more a volunteer, but I'm a contractor as nurse mentor.
Good for
So
you.
my current work focuses on building the capacity of local nurses through clinical
Hmm.
mentorship, bedside coaching. That's and what we focus on is what safer surgery. So we focus
Hmm.
on what like A2E emergency assessment and pre and post operative, pre post intraoperative surgical care, and also wound care, aseptic non-touch technique, documentation,
Wow.
professionalism, and a lot of more. That a lot more that impact nurses, and it's
Yeah.
really working well. I can see change. So the objective is simply to improve the technical strength and to what strengthen sustainable local healthcare system that
Okay.
can continue delivering what safer surgical care long after international team has left because the ship has left now. Seeing local nurses grow in confidence and competence has been one of the most fulfilling aspect of my career. So professionally, I was also privileged to be interviewed for position of infection prevention and control nurse specialist with UK Med. I'm currently awaiting the outcome, which I'm very optimistic that
You are
I'm going
getting
to
that.
be in there.
You are
Of
getting
course.
that.
So
You
regardless of the result, the experience itself
yes,
affirmed that continuous professional growth and global opportunity become possible when one remains committed so to
absolutely.
excellence. So for
That's the key.
academics, exactly, that's the key. So
Mhm.
academically, I've remained equally committed to lifelong what learning. I've never stopped learning since when I joined school. So I successfully,
Learning is so delicious.
it's delicious. It's delicious. I successfully completed several professional development programs, including pandemic preparedness training
For
by
you.
Afri Health. Yes, that's
Yeah.
Afri Health. Ebola preparedness training by MSF, and last currently I'm doing one training fellowship, Lassa fever clinical management by the Global Health Network. So these programs have strengthened my preparedness of emerging infectious disease and reinforced what the importance of resilient system. Recognizing the growing influence of the digital transformation in healthcare, I also completed like several leadership and artificial intelligence and professional development courses through LinkedIn, and they are really nice and eye-opening. If you want
Yes.
to understand how AI
LinkedIn
will
has
impact
free.
this profession, yeah,
Yeah.
you need to go and do that. It's on the LinkedIn. Some are
You
paid.
gotta want
So
it.
I
You gotta want it to find it. Anything in life,
yes,
you gotta want it to
yes,
find it. And it
exactly,
propels
exactly.
you.
Yes,
It
yes.
propels you
So I
big time.
strongly believe the future healthcare leaders must understand not only clinical science but also digital innovation.
Mhm.
And my dissertation in masters in nursing, it's talking about digital health technology in improving nursing or
Mhm.
adoption in nursing care. So I'm trying to align with the evolution. So it has to be data driven solution. I was telling some nurses that you need to be data driven. Create, even if you are caring
Yeah.
for patients, there are ways you can make it a
Yeah.
data driven, either by the
Yes.
hours, either by the what, by the number of approach, either by the improvement, or what allocate a mark figure,
Yeah.
a number, and mark based on what you achieve and calculate it and make it a data driven. And imagine technologies that will shape what? Shape the healthcare delivery. So from academic perspective, I'm approaching another milestone by concluding my PhD in public health uh, thesis. My thesis is nearing completion, and I have already submitted two review articles for publication. We're waiting for editors to review it, contributing to the
Yeah.
growing body of evidence in infection prevention and control, and as well public health. So at the same time, I'm preparing for my Masters of Nursing and Health Administration proposal defense. So reflecting my belief that effective
Yeah.
healthcare leadership be grounded in both scientific evidence and sound management principles. So beyond my institutional role, I continue to serve as the Chief Executive Officer of the TG Care Foundation, where we organize community health outreach, support vulnerable population, and promote preventive healthcare through mentorship, initiative, and public health advocacy. So these things I just posted this, and I'm going for outreach on Saturday. Saturday I will be leaving Nigeria. I will be leaving my state, going to the capital city,
Yeah.
preparing to go back to Sierra Leone. But I decided to go for outreach at orphanage because we are in outbreak of cholera, and it's already rainy season where malaria will be high. So I want to do a malaria and cholera targeted health education. So I have some nets, a mosquito net with me, and some detergent. So I'm going to ensure I give it out to less privileged and orphans and children and women
Yeah.
that need that. So anyone that is willing to contribute to this, feel free to reach out. You can check it on LinkedIn. So
Okay.
looking back, the common thread throughout this milestone has been committed. It has to be service, continuous learning, innovation, empowering others,
Yeah.
and a lot more. So just check out all these things on LinkedIn. You will see it. And if you want to reach out to
Absolutely.
me, you can connect with me. So
Yes.
I would have loved to give advice to young nurses around the world who aspire to become leaders, researchers. But because of time, let me just try and stop here for my leader to take over. But
Yeah.
it could have been a better thing because it's very important for them to know this. So I
Absolutely.
don't know if I still have like 2 to 3 minutes to
I think
advise
you
the.
should. This is the time is right. Do it.
Yeah. Okay.
Because the
So
beauty of
so
this podcast is that it gets stored in YouTube,
yeah.
and
Mm.
people will see it when we're not looking. So please give your final
So
words. Yeah.
my final words to nurses and midwives around the world who aspire to become leaders, researchers, and agents of positive change in the healthcare sector is first, I will start by saying that my message is just simple, straightforward. Never underestimate the power of what one committed nurse. If
Mm,
you are not committed, be committed. Because
yeah.
I am a committed nurse and I know how I impact the healthcare industry, not only nursing profession. I have a lot of network. I am respected by almost all the healthcare profession. As far as this health is concerned, I am a respected young figure among
You
all
are.
the healthcare world professionals, not only nurses. So I drive this respect. I drive this respect by my commitment. Some are not respected because they are not committed. You need to show yourself. You need to understand that yes, it takes a commitment to do that. So leadership does not begin with a title. It's not about title. It begins with taking responsibility, demonstrating integrity, solving problem, and consistently adding value wherever you are. Don't underestimate the value. Some people will are lax with their care. Commit to do that. Whether you work in a rural clinic or tertiary hospital, every patient interaction is an opportunity to lead through excellence. So, secondly,
Absolutely.
commit yourself to a lifelong learning. I've never stopped learning, guys. Always you'll be seeing me updating certificate. Some will be
Yeah.
wondering what will I be doing with this. I equip myself. So healthcare changes every day, and our knowledge must evolve with it. You can't stay stagnant with your 10 years knowledge. You need to evolve. Pursue higher education when possible, attend professional training, earn certification, learn new technologies, and remain intellectually what curious. Every
Mm,
course you complete become another tool that equip you to serve better no matter what. So I also encourage the nurses to embrace the research. We should
mhm.
not only consume evidence. I always say that. That's why I push to ensure that we have this NOS title. The people must use it
Yeah.
because it's
Yeah.
very important. We should generate it. Every challenge you observe in your workplace may become a research question that leads to
Mhm.
improved patient outcome. Utilize that opportunity. Research allows nurses to what shape clinical practice, influence policy, and
Absolutely.
contribute meaningfully to global health. One last thing is build a stronger mentorship relationship. We have a lot of people that know ahead of us and have been in this field ahead of us. Establish a relationship. Every successful professional has benefited from mentors, and as you grow, become a mentor to others. Don't learn
Yeah.
and stop what teaching. You learn,
Yeah.
teach, you pass it on to generation.
Yeah.
Knowledge multiplies when it is shared. Leadership is measured not by how many followers we have, but by how many leaders we develop. So
Yeah.
develop skills beyond clinical skills, communication skills, leadership, project management, quality improvement, digital literacy, artificial intelligence, public speaking, and
Yeah.
policy advocacy are becoming increasingly important. The future belongs to healthcare professionals who combine what clinical competency with these broader skills. So I also encourage nurses to collaborate across discipline. Work with doctors, work with physiotherapists, pharmacists, veterinary doctors. Today's healthcare challenge require what? Teamwork among nurses,
Mhm.
doctors, pharmacists, laboratory scientists, veterinary doctors, environmental health professionals, data scientists, engineers, policy makers, WASH coordinators. Collaboration is at the heart of effective healthcare delivery and aligns perfectly with the One Health World philosophy. Above all, never lose sight of compassion. Technology will continue to
Mhm.
advance, but patients will always remember how you made them feel.
Mhm.
Do not shout at patients. Be empathetic when you report,
Yes.
provide care. Competence saves life, but compassion heals the heart.
That's
So
true.
finally, I want every nurse and midwife listening today to recognize that our profession has enormous potential. We are not just caregivers, we are educators, we are what? Innovators, we are researchers, we are advocates, we are policymakers, we are entrepreneurs, we are change makers. Never allow your current environment to limit your vision. Yes, I'm
Mm.
from Nigeria, and I've never allowed that. Yes, there are challenges, but I've never allowed that to limit
Yeah.
me. I'm
Yeah.
going global. Start where you are, use what you have, remain committed to excellence. Don't forget this, and trust the word. Every steps of growth prepares you toward to greater opportunity. Often as I often remind young professionals, your greatest investment is not in your salary.
Mm.
Sometimes it's not in your salary, though I understand it's good. It is
Mhm.
in your capacity. Build your knowledge, strengthen your character, serve with excellence, and
Yes.
opportunities will continue to find you. This is what is happening with me.
It will find
Together
you.
we can build enough skills.
Yes.
Yes. And that
It
is
is
that
so
is
true.
innovative, evidence-based, compassionate, and capable of transforming like healthcare for the generation to come. So
Mhm.
this is what I can tell our young nurses. Thank you very much, Dr. Nepu,
Wow.
for this great opportunity
Wow.
to
You have written a whole book for them. If anyone wants to know how do I live from point A to point B, how can I
yeah.
be like this Nigerian
Mhm.
nurse, a male nurse? How can I be
Mm.
like him? How can I be like this Liberian girl called Nyepu
Yeah,
who grew up in a village?
exactly.
I grew up in a village in Liberia,
Yeah, you see,
okay?
yeah,
And then
yeah,
we had a civil war. Then we left from Liberia. I was a refugee. So
exactly. You
how
see.
can you be like me? How can you be like Nurse Ruben? It's
Hmm.
called connection. It's
Hmm.
called be willing to serve.
Yeah,
If you are willing to serve and you're willing to connect, you will learn something in that connection. As you
hmm,
serve, you will receive something as a payback, and
exactly,
it will catapult your professional journey. And as
exactly.
Nurse Ruben said, do not lose your compassion for your patients.
Never.
Because if you lose that, you might as well just go and become AI. Because AI
Exactly.
needs your human compassion to apply
Yeah.
the fast knowledge, the fast speed of information. AI does not
Mm.
have compassion. Sometimes ChatGPT has bipolar days. So you don't lose your compassion and
Mm.
always be willing to connect with another professional and see what can I learn from this. It's not about what can you give me
Mhm.
monetarily. That's gonna come later on. And Nurse
Exactly.
Ruby touched on that. And
Exactly.
this message goes deep to nurses in charge,
Hmm.
members globally, because a lot of them, the first thing you tell them about nurses in charge, they say, "Oh, what are they paying me to be there?" Okay,
Hmm.
nobody pays me to be the founder of nurses in charge to put endless
Good.
hours. When I go to I
Yeah.
feel way that I know a nurse named Reuben.
Yeah,
The
exactly.
goodness of
Network
this
is very, it
that I've
pays.
come to know. And by the
Mm.
way, Nurse Reuben, if you read in the chat, in NIC Global chat, in the WhatsApp, I call you a legend. And that's who you are.
Thank you. Thank you, Dr.
That
Nepo.
is
I'm really
who
honored. Thank you.
you have
Thank you.
cultivated this persona
Mm,
and this
mm.
professionalism. You are a legend. And a
Thank you.
legend is born being, groomed. And you have to allow yourself to be groomed. So anyone
Exactly.
listening out today, we are just ordinary people, my people. We're
We
just
are. We are
ordinary
ordinary.
people.
I can see my class rep. I'm the class rep of our. We are the first set of the masters postgraduate studies in our
Yeah.
university. I'm the class rep, and this is the assistant class rep. But I've given her the power now. She's the class rep. Her name is Nosfalmata Nasru. Thank you very much for joining.
Awesome. There she
Yeah,
is.
yeah. She's a lecturer. Yeah, she's a lecturer, the
Wow.
clinical instructor with the
Uh-huh.
University of Maiduguri here in Nigeria, and she's really absolutely nice, very well equipped and intelligent,
Yes.
and really committed to her work, which is
Wow.
what we need of nurses. So I'm honored to have her.
Wow.
Yeah, she's a nurse
So,
midwife
Nurse,
from here.
Nurse Farmeta,
Yeah,
you are welcome to Nurses in Charge. We are iron sharpening irons. We're not
exactly.
rubber
Yeah,
sharpening irons. We are iron sharpening irons. So you are a nurse in charge in whatever you're doing out there, but then we come together as a global family to build each other up. And this is part of what we do for fun. So thank you everyone for joining us. It has been a marvelous Sunday with you all. Nurse Rubin, we have a lot of coaching to do as
yeah.
you have a strong suit in that area because our new generation of nurses and midwives coming up really need someone to give them words of wisdom and for them
Yeah.
to keep up the journey. So whenever you have time of mercy or ship, come let's just have a conversation out here and just give a
Thank
boost
you.
of encouragement to any nurse out there, any midwife who may be feeling down and not feeling encouraged to move forward. You have to take one step at a time. So we say thank
Exactly.
you. Let me know if you want to share your story out here. The email
Yeah.
is right on the screen here, the nursesinCharge@gmail.com. And your story is most important like everybody else's story because it's unique. That's your story. Your story is not the same as mine. So and we don't charge you anything. Nurses in Charge, we don't even
Mm.
have fees. We don't have membership fees yet. So come and join us. Let us grow this global family. And lastly, I want to tell everybody in December of this year, we are going on a medical mission to Kenya. We're going
Oh,
there to connect with nurses there, with midwives, and we're going to serve an orphanage, special needs school, and other things. Safari, everything is
yeah.
we will have fun at the same time serve. So if you're
Yeah.
interested, you want to give your skills, you want to share your skills out there, you want to meet other nurses. We are spearheading this by December. We will, by God's grace, we'll be going to Kenya. So feel free to join us. Send me an email, and I'm a humble servant here. So feel free to join us. Share the news.
So I
And
don't know. I don't know. Just a humble request through the education
uh-huh,
department of nurses in charge. I don't know, as
okay.
the director, if you can look into this issue. I am pleading if you can organize a basic, even if it is a 1 month basic training in infection prevention and control through
Hmm.
collaboration with the Infection Control African Network or any other infection control agency that is accredited
Yeah.
to have a valid training. So, what I can do from my own aspect is supporting you with a few speakers, solid speakers that are expert
Okay.
and are serving elsewhere. They are from Nigeria, but they are serving with organization in other countries, and they are vast in this experience. If you will do that for Africans, looking at the context where Ebola
Uh-huh.
is now ravaging us, I think it will
Yeah.
be of greater help. So thank you. So
Yeah.
that's it. That's my
Thank,
home.
thank you for your suggestion, Nurse Ruby. But how do I say it? The the torch that NIC gives every nurse out there who has a project. You are the
Okay.
project manager, and NIC is open for
Yeah.
you.
Okay.
So
Okay.
I will pull some strings, and then you lead us how you want us to do this. It can even be a boot camp. We do it for a weekend, right? Friday, Saturday,
Exactly.
Sunday, boom, 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 and bring
Yeah.
speakers and we learn from each other. So, but I need you to spearhead it. We'll bring it on and we'll work together and make it happen. So awesome,
Okay.
awesome.
Thank you. Thank
We
you.
have a project proposal. We will work together on that.
Thank you
Awesome.
very much.
Thank you, everyone. See you guys again another appointed time by the grace of God. Be blessed and continue to learn and continue to serve.
Thank you.
All right. Thank you, Nurse Ruben. Thank you for your patience when we had the
Yeah.
technical issues.
Yeah, they
Awesome.
can they can they can connect with me on LinkedIn, and if anyone want to go and serve as volunteer, I will share the links with them to go and serve. It's very
Okay.
important. It boosts your CV, it projects you,
Yeah,
it helps you in connecting with a lot of people. I have different
absolutely.
charity organization, like
Hmm.
paid and not non-paid volunteer opportunity link. So I'm willing to share with people. So let them just connect and DM me on LinkedIn. Thank you very much for
And
your
that's his
time.
name out there on LinkedIn. It's all spelled out for you. Feel free to connect. This is how we connect globally. So feel free to connect with Nurse Ruben. And if you have any questions for me, guys, you have the email out there, or just search me on LinkedIn as well. That's my full name on LinkedIn, Facebook. Feel free to connect with us. And you all have a blessed week, rest of your week, and take care. Thank you, Nurse Ruben.
Thank you.
It's been an honor.
Thank you. Same
All
here.
righty. Thank you. Bye, everyone.